My name is Dr. Denise Billings. I am an optometrist, board certified in Port Charlotte, Florida. I first got interested in the field of optometry as a 6-year-old when I received my first pair of glasses, and of course went for yearly exams until I was in optometry school. I didn't realize I had anything unusual with my eyes, but I did, and it was driven home when I was a patient for a second-year student trying to prove he was proficient to get into the clinic, and I walked in with nothing. And I have a high hyperope, I'm strabismic, I'm amblyopic slightly, and this poor young man was just befuddled, but it didn't slow him down. He went on to become the dean of Pacific University of College of Optometry. His name's Dr. Lee Carr, if anyone's heard of him. My medical training, my optometric training was at Ferris State College, College of Optometry. It's now called Michigan College of Optometry in Big Rapids, Michigan. My first practice was just up the street from here. This is 2135 Tamiami Trail, and my first practice was 1825 Tamiami Trail. That was my first private practice. I did a little bit of work with Eckerd Optical back in the day and a year with Cigna staff model HMO in Tampa when I first moved to Florida. I worked for 1 year before moving to Florida in an ophthalmology practice in Rochester, Michigan. I really enjoy helping people see better and have more confidence in themselves because they're seeing better. And I also really appreciate being able to tell them their eyes are healthy, and if they're not healthy, to get them the best possible treatment. Well, one of my most memorable patients was Mrs. Brown. I'm sorry, Mrs. Kelly. So Mrs. Kelly had cataract surgery, and she came up for her post-ops with me. This was my first year of practice in the ophthalmology practice in Rochester, Michigan. And she said, "I am so upset with my husband and my son. They let me buy the ugliest brown couch, and it's not brown, it's green." She could now see the new color without her cataracts there. The factors that contribute to my success, I believe, are my ability to listen. I try to listen really hard to what the patient's saying, what their words are saying, what their gestures are saying, and I really try to take it to heart to try to get to the root of their problem. Usually it's a vision problem, but not always. I really enjoy being part of Quigley Eye Specialists. Like any transition, it hasn't been completely smooth, but overall it's been a very positive experience. Lots of support from other staff members. Administratively, the first year was wonderful. I had a liaison that we spoke first every week, then it lengthened out to every 2 weeks, once a month, and now we don't even need to speak, but she helped me through the transition. It was wonderful. The biggest advantage for me to be part of Quigley Eye Specialists is to be one of a very well-known group and very proficient group. Everybody is practicing to the highest of their abilities, and it makes it nice for me to be able to refer my patients that need help beyond the optometric help to someone that I have complete confidence that they'll do a good job. I think a patient should consider coming to me for treatment because I am caring and I do listen, and I've been doing this for almost 40 years rather. In May it'll be 40 years. I started when I was right after that first pair of glasses when I was 6. My work-life balance since I became part of Quigley Eye Specialists has really improved. I have much less stress in terms of running the business side of an optometric practice. Lots of decisions, how to price contact lenses, how to price frames, what frames to order, what equipment to buy. Those are just gone. If I need any new equipment, I just call Tina, my site manager, and she orders it and it's waiting for me, the next day or so. Same thing with maintaining all the equipment and the physical plant of the building. It's not on my shoulders anymore. When I was considering joining the Quigley Eye Specialist group, it was because I needed a knee replacement. And my husband at the time, we were no longer together unfortunately, insisted that I sell my practice before having the knee surgery due to the a previous injury that I had back in 1990 that left me out of the office for 5 months. And he just didn't want to have to deal with that again. And I fully understood his where he was coming from and started looking to sell my practice. And I happened to go into a breakout meeting at South Seas 2 years ago. It was called So You Want to Sell Your Practice. Frances Wilhelm saw me coming out of that meeting, and she said, "You want to sell your practice? We want to buy your practice." And the rest is history. I chose Quigley Eye Specialists, quite frankly, because they gave me the best offer, and I was Frances, Wilhelm, would not let it go. She called me, she texted me, she stopped in. I was negotiating with another group as well, and when I told them, I told both groups I didn't think I could do it. I hadn't been an employee for over 30 years. The other group just let it drop, but Frances did not let it drop. She nicely hounded me, and like I said, the rest is history. I'm very happy Quigley Eye Specialist myself now. If you are considering joining the Quigley Eye Specialists, I would recommend shadowing a practice. I would recommend getting everything in writing if you have certain concerns. I have found that the Quigley Eye Specialist admin is very diligent in terms of making sure anything that was in writing is adhered to. And just do your homework.